In the wake of the COVID-19 pandemic, the UN Support Office in Somalia, UNSOS, has employed various interventions to mitigate the spread and impact of the virus. A key priority is the safety of staff and stakeholders.
We activated the crisis management system and the executive crisis management team, the SRSG, the designated official and crisis manager, as well as his deputies, and the executive committee was formed. So what we had was oversight, executive oversight guidance, leverage, the right delegation of authority to implement all the actions. We stopped all non-essential travel. We started reducing the size of our meetings, taking advantage of technology so that we could do a lot of things virtually. We also reduced the footprint of other personnel that usually have here, mostly contractual personnel. We had over 1,000. So we scaled down to only essential activities that were necessary in support of our core mandate, and everything else was suspended. And over the last few months, we've been able to tremendously increase our medical capacity to meet the projections. That was done by our medical tool. As a result, we have over 20 intensive care unit beds now across the country. We have 45 isolation beds. We've ordered a large number of personal protective equipment. We are making sure that we have the medical personnel as well. We surged medical personnel with additional doctors. And all these measures, by the way, apply to the whole of the Somalia. Now we are dealing with all the, shall we say, the related activities, mostly having to do with how to manage, continuing to perform the core activities of the mission, and ensuring that the staff and colleagues have the right work-life balance and that they're not too overburdened. So with 60% almost of the staff out, Somalia telecommuting, there is a heavy burden on the remaining over 40% living in the mission. So we're now putting in place a rotation plan that will allow us to have those people been out, telecommuting, to replace some of the colleagues who've been here for a long time.
UNSOS is helping to lead the charge against the spread of the virus by installing sanitation, screening, and isolation facilities at the Aden Abdullah International Airport. UNSOS procurement section adjusted to the changes triggered by the pandemic by using e-transactions to facilitate quick procurement of critical life-saving equipment.
Despite global demand for some of these really very hard to source pieces of equipment, we were successful within the very first few days of the pandemic in getting some local supply, even from smaller suppliers in Somalia, of PPE and medical equipment. We have a once-a-week team meeting using MS Teams, and it's working really well because it allows everybody to speak. We get to see each other's faces, see how everybody's doing.
UNSOS Field Technology Section, FTS, has also facilitated remote working for UN staff by providing advice and technical assistance to stakeholders like AMISOM and the federal government of Somalia.
As at the last count, we had 600 unique IDs. That is people who could telecommute from all over the world. And we take that into consideration, especially during the during our town halls.
In an effort to mitigate risks among staff and stakeholders, UNSOS installed hand-washing basins in the UN, AMISOM, and all access points to Halani Base Camp. Other preventative measures put in place were daily disinfection of UN air terminals and aircraft, and in posting public awareness in all public spaces. UNSOS has also converted an accommodation unit into an isolation ward to be used to handle suspected COVID-19 cases.
What we have done is we had a facility in phase 9 which is close to this location, which was meant for accommodation purposes, so it was not utilized by somebody. So what we did, we immediately convert that as a hospital annex as an isolation facility for the medical.
Globally, and for UN in Somalia, COVID-19 has caused disruptions in social and welfare activities.
COVID-19 came in to actually attack the very foundations of welfare activities. Welfare activities generally revolve around bringing people together. But with COVID, the situation has changed to actually think outside the box in order to support our colleagues, those who are still in the mission. So we agreed that the staff in the sectors will have PX items now shipped to them. So we've done this for April. We've done it also for May. It's not a perfect system, but we are trying to improve. And we have to do it again in June. We expect that it will get better. We are also bought through a fast-track procurement system, gym equipment for them. These are being shipped to all the sectors so that they'll be able to enhance their physical training. Exercising has been the main thing for most people. So our gym instructor, Hilary, also keeps the people busy through circuit training.
UNSOS and other international partners continue to uphold their solidarity with the people of Somalia and the government at all levels in the global effort to stop the spread of the coronavirus, COVID-19. UNSOS, in coordination with the UN Resident Coordinator's Office and UNDP, launched a special UNSOS flight transporting two 350 kVA generators from Nairobi to Mogadishu hospitals. Additionally, UNSOS flights have so far transported some 22 tons of medical equipment in support of different federal member states across Somalia.